This patient had a right frontal avium. If you carefully notice, there is a Fistulas component within the avium. You note that there is a venous aneurysm, a significant venous angiopathy, and venous hypertension. The oblique view clearly shows the Fistulas component. You note that there are some secondary collaterals from the anterior cerebral artery as well. As it was a high flow fistula, the plan was to perform a balloon assisted Onyx embolization. Note that the phagomax was taken coaxially across the tight loop in the internal carotid artery to the posterior genu of the cavernous ICA. The working projection clearly demonstrates this high flow fistula ending into a venous aneurysm and a giant venous sac. Note navigation of eclipse 12 balloon into the intracranial ICA from a guide placed in the cervical ICA. A sonic 1.5 French 35 mm being navigated close to the fistula. Note the tip of the sonic right at the fistula point. Initial injection shows extremely high flow fistula. A 2L balloon eclipse was then navigated into the artery that supplies the fistula. This was initially placed proximally. Following balloon inflation in the parent artery that supplied the fistula, a microcatheter injection was taken, and this showed a significant high flow component still persisting. A run from the balloon revealed that it was not occlusive, and therefore the balloon was inflated more. Following that, a flow change was observed from the microcatheter injection. The guiding run taken after that showed dilatation of the artery at the site of balloon inflation. To achieve better flow control, the balloon was navigated as close to the fistula as possible. The balloon was inflated, and the run taken post-balloon inflation showed significant change in the flow. We started with a strategy of injecting Onyx 34 from the balloon catheter when the balloon was inflated. Following that, injection was performed through the sonic 1.5 35 mm microcatheter. You notice Onyx percolating into the fistula site. Note the run taken after injection showed complete occlusion of the fistula and also dilatation of the parent artery at the site of balloon inflation. Notice there is stagnation of contrast in the venous side, and this is the final Onyx cast which shows Onyx at the arteriovenous junction. Post-procedure, patient did well.